All right, welcome back. Hope you're all having a great week so far. Today we're going to continue our practice question series for the RBT exam, where we're going through 10 RBT exam questions and breaking them down how I think you should think about them on your actual exam. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Visit rbtexamreview.com for all our practice materials, including 3 practice exams, our task list study guide, our combo pack, which comes with everything, and then of course our competency study guide as well. We got some really good feedback lately, have a lot of RBTs passing, so we're very excited about that. Keep working hard, keep studying hard, and you're going to be next. Any questions or comments, please let me know. Other than that, let's get to our questions. Question 1, discrimination, as it is used in applied behavior analysis, refers to what? Okay, so pretty straightforward definition question, okay? Question is simply asking, discrimination is what? What do we consider discrimination in applied behavior analysis? It's a critical skill that we teach to our clients, especially young clients. It's essential to learning and developing. So what is it? A, the process of reinforcing successive approximations of behavior. What is A? When do we reinforce successive approximations of behavior? That, of course, is shaping, right? When we're reinforcing bigger and bigger pieces of a response till we get that final response, we're shaping a behavior. A is shaping, it is not discrimination. B, the act of identifying the difference between stimuli. Well, discrimination is exactly that. If you need to identify red and there's a red crayon and a blue crayon, you're going to identify the difference between those stimuli and then pick the red crayon. That is the definition of discrimination. So B is our answer, but as we know, we always want to read all of our answer choices, especially when we're practicing. We want to know why are the other answers wrong. That's going to make you a better test taker. So C, engaging in a response outside of the learned environment. What do we call it when our clients start engaging in these behaviors outside of the environment we've taught them in? Okay, it's a very good thing. It's what we want. But what is the name for it? Generalization, right? We train for generalization. We want generalization. Okay, but C is not discrimination. It is generalization. And then D, withholding reinforcement for a previously reinforced behavior. Whenever we have a behavior that we want to decrease, what do? We put it on extinction. And when we put on extinction, we withhold reinforcement for that previously reinforced behavior until it decreases. So for this question, discrimination, as it is used in applied behavior analysis, refers to the act of identifying the difference between stimuli. Very straightforward definition question. Know your terms, know your definitions. Exam becomes much easier. Look at the following graph. What is the rate of screaming for session 7? Okay, so they will ask you, 3, 4, 5 graphing questions on the exam. So you need to be prepared, but they're not going to be any more difficult than this. Typically, it's going to be a line graph. Line graphs are the most commonly used graph in ABA. And as an RBT, it's what you need to understand. So if we look at our graph here, right, this is the rate of client screaming. Our x-axis, which is time, is sessions, 3-hour sessions to be exact. We have 7 sessions down there. And then y-axis is the behavior, it's the frequency of our screaming. We want to know what is the rate of screaming for session 7. So first, you need to know what is rate. Rate, of course, is frequency over time. So you're going to look at the frequency component and then put that over a time component. Our frequency is the y-axis, which is our behavior. So for example, if we look at data points 1, 2, and 3, sessions 1, 2, and 3, screaming happened 2 times across all 3 of those sessions. We need screaming for session 7. What you need to do is visually analyze the graph, find session 7. How many times did screaming occur? Well, we know the data point is on 3, so the screaming occurred 3 times. What is the rate? Well, 3 times per 3 hours. So is it 6 times per hour, 3 times per hour, 1 time per hour, or 5 times per hour? That is going to give us 1 time per hour. Screaming happened 3 times over a 3-hour session. Our rate is frequency over time. So 3 over 3 hours comes out to 1 time per hour. Make sure you understand this question. There's a lot going on as far as how you calculate rate, which is frequency over time, and then how you visually analyze a graph. Neither of which are very difficult. okay? So if you're new to the test, it's fine. Just spend a little time on this question until you kind of grasp how we got there. You look at the chart, plug in the numbers, that's going to give you your rate, okay? Not too difficult of a question, okay? You just have to understand the concepts that make up our answer. You've noticed that your client will sometimes clench their fist while sitting at the table with you. After observing the behavior for a couple of sessions, you notice that the client also does it around peers, around his family, and even when he is alone. What would you hypothesize the function of this behavior is? Okay, so there's a pretty dead giveaway here in terms of hypothesizing functions, right? First, let's talk about our functions. We have tangible. We're trying to obtain an item. Does it appear that the client is trying to obtain an item in this scenario? Well, no, because this behavior is happening everywhere, right? At the table, around peers, around family. Even when he's alone, he's engaging in this behavior. It doesn't seem to be like there's any items involved. So we can probably eliminate tangible. What about attention? Again, it's happening around you, okay? But then it happens around peers and his family, and even when he's alone, okay? So attention doesn't seem to fit if it's happening across all this time, even when there's no attention to gain, okay? So again, he's not apparently trying to gain much from the social environment. So tangible and attention are out. What about escape? Are we presenting with any task? Are we presenting any aversive stimuli? Again, it doesn't seem so. Even when he's alone, no need to escape, it's occurring. So that leaves us with automatic, also known as sensory. It's the same thing, okay? The key giveaway here for why it's automatic is that term alone. So when you're hypothesizing functions, okay, if that behavior is occurring across multiple settings, multiple times, and especially when the client is alone with all the access in the world to what he wants, okay, typically it's going to be automatic or sensory based. The function will be automatic or sensory based, okay? Automatic just means you don't need a socially mediated reinforcer to maintain the behavior. So if that behavior is happening when they're alone, there's no socially mediated reinforcement occurring, therefore it's most likely automatic, okay? That's the giveaway. If you notice that behavior is happening everywhere, even when alone, even with all the items, we start to hypothesize that it's going to be some sort of automatic function. Jeb is sitting at a red light and starts to look at his phone. Before he knows it, the light turns green, the car behind him honks at him, and Jeb starts to pull forward. In this scenario, the honk functions as what? So test yourself before you even look at the answer choices. Try to break this down, break the sequence down, okay? So Jeb is sitting at the red light, okay? The light turns green. What is the light turning green? That's going to be an SD for you to go, okay? But before Jeb starts to pull forward, which is the response, the car behind him honks at him. What do we know comes in between the SD and the response and evokes the behavior we're looking for? A prompt, right? The car behind him honks at him and is prompting Jeb to start to pull forward. So again, break it down. Don't just guess. Don't just jump to the answer choices and try to start eliminating things, okay? Think these things through, okay? It's going to make you way better and faster at the exam. Again, think about it. The light turns green. That's our SD. Jeb pulling forward is our response. The car behind him honking at Jeb comes in between the SD, evokes the desired response, and that's our prompt, okay? Honking is an antecedent, so you could easily eliminate A, C, and D because they're consequences, but don't immediately jump there, okay? Try to really understand the concept of this question. Why is the car behind him a prompt, right? Why is that a prompt, okay? That's how you should be thinking about it when you're studying, because when you get to the exam, you're going to fly through these questions, right? If you really understand the concepts, the test becomes very easy, right? So spend a little extra time, understand the technical pieces of this question, okay? And don't just try to eliminate answers off the bat. You're preparing for your first day as a registered behavior technician. You know you will need to take duration data today and record frequency for aggression behavior. What would be best to bring to prepare yourself to take duration data? So our task list, one of the first items is prepare for data collection, prepare for your session. meaning you need all your required materials, data sheets, reinforcers, whatever, right? This question wants to know, what do you need to bring to take duration data? What is duration data? Duration data is time, right? The length of a response. So if you've got to measure time, you're going to need some sort of time recording device, obviously. A stopwatch, right, is what comes to mind. That can include the stopwatch on your phone, an app on your phone. Regardless, we need something to gather time. A, tally marks. Tally marks, is that going to give good time data? No, okay. That's going to be more for frequency, as is a clicker counter. So A and B, if you were looking at your frequency counting, okay, your frequency data, A and B might be pretty good, as would be D, right? Frequency data sheet, again, pretty good. However, we're looking at duration data. We need that time. Stopwatch is going to be best. Again, same thing with this question. Don't just jump to the answer choices and start eliminating answer choices and narrowing it down, okay? That's not the best way to take the exam. The best way to take the exam is actually understand the question, what they're asking, and try to answer the question before you even get there. Predict the answer, okay? So if we were going to predict the answer here, what would I need to take duration data? That's right, a stopwatch, some sort of timer. Then when we get to our answer choices, we see our predictions right there, okay? Still read your answer choices, but now you're actually taking the test, okay? And you're not just crossing things off, right? So what would be best for duration data? A stopwatch. As it relates to treating your clients with dignity, which of the following answer choices would be your priority? Okay, so this is part of the ethical code of the RBTs. Always treat your clients with dignity. And it really comes down to treating them like you would treat anyone else. Treat them with respect, okay? Treat them appropriately, right? Just because they may have a disability or an addiction, whatever population you're working with, they deserve to be treated with dignity, okay? So of the following answer choices, what should be your priority when treating your client with dignity? A, ensure privacy of client information and records at all times. Absolutely. Again, this is part of the task list, but think about how you want to be treated. Do you want your private personal information everywhere in the world? Absolutely not, right? You don't want somebody just spreading your information everywhere. Same with your clients. Just because you have information about your clients, I know you want to talk about them, but you need to resist the urge to talk about your clients or share their information with people who aren't part of the cases. So A looks like a good answer choice. Let's keep reading. B, engage with your client in age and skill appropriate ways. Should we treat a client who is 12 and functions at a 12-year-old level like a 12-year-old or like a 12-year-old with a disability? We need to treat them like a 12-year-old, meaning if they have age and skill appropriate behaviors for 12-year-olds, treat them like a 12-year-old. Talk to them like a 12-year-old. Don't talk to them like a child, okay? Don't do things that are way too easy for them. Your expectations should match their age and skill. Same thing if you're working with a 3-year-old, treat them like a 3-year-old, right? You get down on their level and just engage with them. Just the rule of thumb is engage with them like they don't even have an addiction or disability or whatever, right? Just another person you're engaging with throughout your day. So B is also one of our answers. C, do not implement dangerous contingencies with your client. What do we know about contingencies? Contingencies are if-then statements, okay? What would a dangerous contingency be, right? Well, let's take adults, If you do this, then I'll give you money to buy liquor, okay? It's kind of a dangerous contingency. Ethically, not sure, right? Point being, right, we don't want to set up our clients to engage in dangerous activities through a thought of our own, right? Again, we're not manipulating them, okay? We're not scaring them. We're not abusing them, okay? We need to treat them with dignity, just like you would treat anyone else. So which of the following answers should be your priority? Well, all of these, right? D, all the above. You should focus on all of these when treating your clients with dignity. D is our answer. John, an RBT, asks his client to sit down, then delivers reinforcement. John then asks his client to pick up a pencil that is on the desk across the room and provides reinforcement. John then asks the client to clap his hands. What type of skill is John working on? Okay, so you might have been making assumptions reading the question. You know what kind of question you're looking at, but then we kind of switch it, and they want to know what type of skill is John working on. And while this isn't explicitly on a study guide, on the task list, they might not even ask you about this, okay? It's important for you to know the different types of skills, right? Because they will ask you about assessments, social skills assessments, functional assessments, indirect assessments, and you're going to have to assess different types of skills. So skills we're asking about here, or we see in our answer choices, are receptive skills, expressive skills, verbal behavior, and social skills. So expressive skills, they're similar to verbal behavior. Verbal behavior, of course, is communicating with others, wants, needs, that kind of thing. Expressive skills is along the same line, right? Communication, talking, expressing one's needs, okay? What is John doing? He's communicating to his client, but he's asking the client to do things. The client isn't communicating back. The client isn't making responses, okay? The client is doing what? The client is listening. There's no peers involved. There's no social skills involved, okay? The client is receptively following instructions, okay? Receptive skills are essentially the ability to listen and comprehend. That's what John is working on here. As an RBT, you're going to work on all of these things. You're going to hear the word receptive a lot. It's listening. Expressive is speaking, right? And then verbal behavior is communicating. And then social skills, of course, is with peers, okay? So again, this question's in here because I think it's important that you understand the different types of skills we look at, and to get you thinking about maybe some assessments you might be doing, because that is part of the task list. Aid your supervisor in assessments. So John is working on A, receptive skills. Reinforcement should be delivered when? Okay, this is a more difficult question, but a very important question. The term here, okay, is contiguity. Contiguity refers to the closeness of something, okay? Reinforcement should be delivered, I'll just give you the answer, as close to the response as possible. We don't want A after a brief delay, okay? The longer you wait to deliver reinforcement, the higher the chance is that you're going to reinforce the wrong behavior. You want to reinforce as soon as possible, okay? As close to that response as possible. You're not going to reinforce before the SD is given because the SD is an antecedent. Reinforcement is a consequence, okay? So the answer here is C, as close to the desired response as possible. That's a very important concept. When you're doing discrete trial teaching and your client engages in the correct response, give them reinforcement as fast as possible. If you're teaching naturally and you observe your client doing good, reinforce them quickly, okay? Reinforcement should be delivered as close to the desired response as possible. Gregory is recording whole interval data as part of his client's treatment plan. Each interval is 10 seconds, and there are 5 total intervals. In 3 of the 5 intervals, the behavior occurs for 10 seconds. In the other 2 intervals, the behavior occurs for 8 seconds. How many responses should Gregory record? So if you can't do this in your head, that is okay. They give you scratch paper, write it out. What are we writing here? We are writing about Gregory taking whole interval data. We've got 5 intervals for 10 seconds each. So knowing what we know about whole interval data, our responses have to occur for the entire 10 seconds, right? That entire interval for it to count. The question says in 3 of the 5 intervals, the behavior occurs for 10 seconds, which is the whole interval, and the other 2, only 8 seconds. So how many responses should Gregory record? Well, we obviously want 3, right? If 3 of the 5 intervals, the behavior occurred the whole time, that's going to be 3 responses. And the other 2, it didn't occur the whole time, and that's whole interval data. Okay, that's it for today. I hope you enjoyed. Please leave any questions or comments below. Like and subscribe. Be sure to check out all our study materials at rbtexamreview.com. I will be back next Monday with more. When you do pass your exam, please let us know. We also have our BCBA study materials available as well as videos. If you're looking to become a BCBA, please check those out. Other than that, keep working hard, keep studying hard. I'll see you soon.